obviously, it is heart-wrenching, all the suffering that is going on in the world. Heart-wrenching, the health issues, the death, obviously, the financial issues, and the stress issues. All three big global problems that are going to take a very long time to resolve. But I'm using it for myself. I try as much as possible to be positive and to use my time very wisely.
What are your routines like? I know you have two babies at home. How are you
Yes.
managing this time with them? What are your routines? What do you walk us through your day?
So my twins turned 2 just last month. So they're very young. They go to a Montessori. So they have e-learning to the Montessori. So that's 2 hours of our day, 1 hour for each. So I'm enjoying that part and teaching them the small things that will become big things. And the other parts of my day, I try to reserve 2 hours of my day for exercise, biking, running, calisthenics. And I also use my time for creativity, for reading. I try not to use a lot of my time for television. I think, an hour or two a day is a good amount to stay informed. But I think more than that, it really weighs very heavy on you and on your soul. So that's how I've been managing my day. I've tried to be very productive.
Do you get outside or are you staying home?
I go outside. I go very early in the morning when there's almost no one. And I wear a mask all the time when I go outside to exercise. And I go very rarely to the supermarket. I try to do it maybe just once every few weeks and for necessities. But most of the time I've been home other than the small outings.
Great. We have some questions. We're going to get started just to get the conversation going. Your specialty is facial, or you do a lot of rhinoplasty, right?
Yes, I enjoy the face a lot. During my training, the last part of my training, I did a craniofacial fellowship, and that's for surgeries mainly involving the face, especially in children with deformities. So I have extensive training in the face part. So I enjoy facelift, I enjoy noses, I enjoy necks. Anything above the neck, I really enjoy to do. And that's 70% of my practice.
So we have some questions. Do you do dimple surgery?
I do.
And request?
How does
the procedure work?
The dimple surgery is fairly simple. And it's creating a small dimple on both sides for patients that have a very small dimple or no dimple at all. And it also tends to thin the face a little bit because of the dimple creation. It's done under local anesthesia. An incision is made inside. One suture recreating the dimple. It takes about 20 minutes. And you have a nice dimple. Now, sometimes there are requests for very deep dimples that people see, I guess, on social media or where they see them, but those are not realistic. The dimples that I create are very subtle, they're very soft, with an accentuation upon smiling. So they're very simple dimples.
We have a question from one of our participants. For men, what do you think are the most effective ways to get rid of a double chin?
The double chin is very complicated. The double chin is a combination of 4 different things. It's excesses of skin, it's excesses of fat above the muscle, fat under the muscle, and then it's laxity of the muscle per se, and the muscle's name is called the platysma muscle. So depending on the percentage of contribution of the different aspects of the neck, then a very customized plan need to be made for that particular person. Usually, and I've been doing a lot of video conferencing at home and consultations at home through the phone like we're doing now. And usually through pictures, I can tell patients, maybe it's just liposuction, maybe it's a neck lift, maybe it's tightening the muscle, what type of incision are needed for that particular patient. Sometimes it's just Kybella if it's not a lot. Sometimes it's even cool sculpting if it's not a lot. So for different people and different expectations, different procedures.
How does the virtual consulting process work, since now it's
You know,
maybe you're seeing your patients.
I've been impressed with this. I had never done it before. Patients usually like to come in person. I used to do it for somebody from New York or from another continent that wanted to have surgery done here and couldn't do the pre-op process in person. But that was maybe just 10% of the practice. But now it's become almost 100% of my practice, and I'm enjoying it. I'm enjoying it. I've adapted to showing before and after photos. I've adapted to really create a detailed and customized consultation. I have my entire team on the call, and they can add and give the pre-op processes and even do a booking for surgery. So we've adapted to this new time of isolation.
Are you doing surgeries now?
No,
No.
we have not performed surgery since March 19th. And because non-essential surgeries, as a mandate, they were stopped in almost every state in the United States. So we have not, but I heard they're resuming at the beginning of May 8th for certain hospitals, and I'm sure the plastic surgeons' offices are on the same time. So I look forward to restarting. We're trying to establish protocols now of how it's going to be performing the surgeries on the other side of the pandemic. You know, now I'm getting my patients COVID-19 tested. We have a place we work with that does this testing, and ourselves in the practice, we're going to be all tested as well every few weeks or so to make sure that everyone is negative. So we're taking all the steps in place to restart sometime in May.
You mentioned Kybella as one of the treatment options for the double chin. Is it safe? Can you tell us more about that?
Yes, Kybella is very safe. It's an acid, and the acid, what it does, it destroys a percentage of the fat cells. It works very well for the neck. If the neck has excesses of fat, not excesses of skin or muscle, and if the excess of fat is mainly in the central part of the neck, Kybella works great. It's 3 treatments, it's once a month. And for most people, you can expect a good 50, 60, 70% improvement in the neck. Now, if you have excesses of fat or muscle in addition, then Kybella is not a great treatment. But for people that have just a moderate amount of fat, it's fantastic.
I've heard that people use Kybella in other parts of the body as well. Is it FDA approved for other?
It's FDA approved for the neck, and it's off-label. We call it for the other parts of the body. So another part that I frequently use it for is the little fat right above the axilla, above the breast, right next to the axilla. A lot of people have a little excess of fat there. It works great for this. Sometimes a very defined fat in the lower abdomen, it works great for this. So for very special circumstances, we use it off-label.
What would you say, this is also from a user, what would you say is the normal range of age for a facelift?
There is not a particular age for a facelift. When you look in the mirror and you feel that your face or your neck has aged to a certain degree that you don't feel comfortable with, or that doesn't reflect your inner self or your personality, then it's the time to do the facelift. I've done facelift as long as mid-40s to 70s, 80s. So there's not one particular time. Some people think you should do it earlier in your early 50s because there's less aging, so that it's not such a huge transformation in your 60s and 70s when you do it. And there is some truth to this, but it's not entirely true. I think people in their 60s and 70s can have an amazing facelift that you can barely tell it's been a surgery and still have a great result.
Someone is Gina is asking, what would you recommend as a great post follow-up facial for someone recovering from rhinoplasty or Botox?
Well, for Botox, you can have a facial 3 or 4 days later, and you can have the facial that works well for your particular skin type. May be hydrofacial that we perform a lot in my office, may be microdermabrasion, may be just an extraction facial or an oxygen facial. Any facial that works well for your skin is fine about 3 or 4 days after Botox. When we do a facelift, I have the patient come into my office every day, the first 5 days, to get a lymphatic drainage massage. We have very specialized masseuses that do these massages, and I really highly recommend that they're done to remove the swelling. Usually there is not much in terms of bruising, but the swelling. And then after this, about 2 weeks later, then again, they can resume their facial depending on what their skin type is. Oftentimes when I do a facelift, I do a laser resurfacing at the same time. So if that's performed, then the skin is revert. We reverse the aging of the skin proper a good 10 years. So I start the facials 2 weeks after that. And I think hydrofacial is a very good facial after a facelift.
Are there good and bad candidates for facelifts? Is there some protocol? How do you determine that?
You know, there are so many different parts of the aging process. So the aging process, I look at it as 3 different processes at once. It's the laxity of the skin, is volume loss, and the skin changes, the skin proper. So I treat those in kind. So somebody that lost a lot of volume in the face, which is very common, then you need to do fat grafting in addition to their facelift. The face and neck lift itself corrects the laxity, and then the laser resurfacing, usually CO2 fractionated, corrects the skin aging proper. Now, in addition to this, some people will age more around the eyes, the forehead, the mid-face, the neck, the lateral face. So depending on what part of the face carries more of the aging, then the facelift needs to be tailored to that particular person. I don't think there is a bad facelift. Obviously, it can be overdone. You could have someone, a surgeon, with somebody with a lot of aging in their mid-face, not correct the mid-face and correct the lateral face. And obviously, those may lead to results that are not natural looking. But if the aging process is treated in part to what is really happening, then the result is great. I do a deep facelift with a smash technique. There is a deep layer of the skin called the smash, and I tighten the smash when I do the facelift. That's a big part of correction of the mid-face. I think if there is a bad facelift, it's from under correction of the mid-face, usually.
How long does a facelift last?
With a normal candidate who takes care of themselves, nutrition, protecting from the sun, managing their stress, living a normal life, a facelift should last a good 15 years. The clock is reset for 15 years after a facelift. And so it will take 15 years for you to get back to your current point of aging in a person that takes care of themselves and in a facelift that's been done properly.
What is your most commonly requested procedure?
My most commonly requested procedure or procedures of the face, we have patient that come in and they said, I'm not ready for a facelift and I just want some improvement. And for this patient, sometimes I do fat grafting on the local with a non-invasive technology such as a radio frequency. Facelift itself is a very big part of my practice. Noses are big parts of my practice. Chin implants, eyelid surgeries, all these are very, very important parts of my practice. I don't think I could pinpoint one. Oftentimes, I do them in combination. I've done faces in combination with noses. In a person where the nose, for example, is a very accentuated nose and takes away from the face, if you do a facelift and you don't correct the nose, maybe even the accentuated nose will become more evident rather than less. So again, it's a study of human physiognomy. It's a study of the aging process. It's understanding the art of what looks natural, of what's going to look great for that particular face. So a lot goes into planning for procedures of the face.
You mentioned chin implants. Who's a good candidate for that? And how do you make the implant?
So there are 2 ways to treat the recessed chin. So the chin could be recessed in a vertical direction where, you know, the chin is too high up, or it could be recessed in a horizontal dimension where the chin is pulled back. And people that have a chin that's recessed in a horizontal dimension with good dentition, their bite is perfect. It's not a defect of the mandible itself, it's of the chin. Are great candidate for augmentation of the chin. There are two ways to augment the chin. Chin implants is one, and the implants are made of hard silicone. They're made by different companies, and there are different sizes, different lengths, and you have to study what length, what size is the right one for that person. The incision to place the implant is sometimes inside the mouth, in the sulcus of the lower lip, and sometimes underneath the chin to place the implant. But more and more, I am augmenting the chin with patient's own fat, which is fat grafting. So I will harvest some fat, and then I will prepare the fat. And in the right candidate, somebody who doesn't smoke, who's not diabetic, fat grafting is an amazing result for chin augmentation. And you don't have to go under anesthesia, and there's almost no recovery. So it's a very nice procedure for chin augmentation as well.
Who is a good candidate for eyelid surgery? Eyelid lift surgery.
So there are many components to the aging of the eyelid itself. One of it is the position of the eyebrow. Sometimes you come and the person says, oh my God, my upper lid is so heavy, so hooded. At night when I read, sometimes I can barely read because there's so much heaviness in the upper lid. And it could be the eyebrow position that has come down, or it could be excesses of skin and fat of the upper lid itself. So if it's excesses of skin and fat of the upper lid, that needs to be done with an eyelid surgery. If it's the brow position that's too low, it needs to be corrected with a brow lift. The lower lid, the same. There are excesses of skin, excesses of fat, and that needs to be corrected with a lot of detail. Some people, you can correct it just by an incision inside the eye, that's called transconjunctival. And some people, you have to resect skin in addition. And then the third part of the aging of the lid are the crow's feet. The crow's feet is not treated by upper lid surgery nor lower lid surgery. It's treated to some degree by a brow lift. But in addition to the brow lift, oftentimes you need a laser resurfacing or a facelift to really improve the crow's feet. There is something else called the malar mound or facetune. Maybe you've heard of this term. It's not fat in the lower lid itself, but it's just under the lower lid. And with specialized technique, it's right here. And with specialized technique, we can treat this as well as part of the lower lid surgery.
What is the difference between fat grafting and fillers? Like, can you?
Well, the fat grafting is a small process under local anesthesia that involves removing your own fat, purifying your own fat, and re-injecting your own fat right away. So fat grafting is, in the right candidate, a permanent process. It lasts forever. The fat that you replace should last forever. A filler is a substance, manufactured substance, such as Restylane, Juvederm, Radius, Sculptra, and it's a substance that is injected. So they have a very specific time that they last in your body. The fillers, such as Restylane and Juvederm, last from 6 to 7 months, and then the Radius and Sculptra about a year. The long-term fillers are not approved in the United States. So silicone injections or biopolymer injections are not approved in the United States. So if you're going to go get a filler and someone tells you this is going to last forever, please do not do it. They are not approved. So the fillers, they come in 1 cc syringes, usually 1.5 cc's. So you inject, for a person that has very little aging, for example, of the nasolabial fold, which is this line here, 1 cc, 2 cc's, Restylane, Radius, or different types of products. Different parts of the face respond better to different fillers. So the cheeks works better with Sculptra and Radius. The nasolabial fold works great with Restylane. The lips, you can only inject Juvederm or Restylane. The line underneath the eye, the nasojugal fold, you can only inject Bolotero or Restylane. So different parts of the body of the face, different fillers. But the fat is a different process, is a more complete process, a more natural process. And done in the right way, it should last forever.
Great. That was one of my next question. Is there a preferred age for patients receiving fat transfers or doing graft?
No, I think I've done fat transfer in different ages. I've done fat transfer patients in their 20s wanting to augment their lips in a permanent way and in a very natural way. And I've done fat grafting in people in their 70s with a lot of volume loss, wanting to restructure their face. In a person in their 60s to 70s, restructuring the face, fat grafting, sometimes you use 50 cc's, 60 cc's. It's a lot of volume, but they need it. And in a person who's in their 20s who just want a little bit of fat in their lips, maybe just 2 or 3 or 4 cc's is plenty. When you do fat grafting to the chin, which we were asking about chin augmentation before, I use between 5 to 10 cc's to get a very nice chin.
Now, you say it's permanent. What if someone's unhappy with a result? Is there a solution to that? Is there something else? I know that if someone has filler in their lips, there's a solution that you can reduce it if they're not happy with that result. What happens with fat grafting?
Fat grafting, you really need to do it with somebody that really knows proportions, because they're a little bit difficult to remove if they're not done properly. So you really need to do it with someone that has a lot of experience and that is in the same vision as you are for your face. And if it's done properly, we rarely have a patient come in wanting to reduce what has been done. There could be swelling for a few days after the procedure and people worry a little bit, oh my God, is it gonna be okay? I feel it's a little bit big, more than what I wanted. But usually within a week, within a few days to a week, the result is just the right result.
It's a question from one of our participants. How important is getting lymphatic drainage massages after lipo?
We do it in our practice, and I've been doing lymphatic drainage massage after almost every surgical procedure in my practice for more than 10 years. We have very experienced staff doing these massages. I think it's very important. Lipo in particular, to redrip the skin nicely, to remove any irregularities. If there is a little bit of scar tissue on the inside, to improve this. I think it's also extremely important for the nose, if there is a little bit of blood under the skin, so that it doesn't become an irregularity, to massage it early. So I do lymphatic drainage after almost every procedure in my practice.
What, for men, this question is for the guys. What is the best hair treatment for men that have thinning hair? Do you employ any methods in your office, in your practice?
We partially treat hair loss for both men and women. And we do PRP, which is taking your own blood, taking some products in your blood that stimulate blood flow and increases hair regrowth. And PRP is the process that's done once a month, usually between 4 and 6 times, and it works very nicely for people with thinning hair. It does not work for people that have lost their hair. I'm getting a few messages from different patients that they say they see me and they cannot hear me. Is there something I can do on my side?
No, I have
You can hear me fine? Okay, perfect.
hear you perfectly.
Perfect. I got some text messages from different people. Very well. So PRP for thinning hair works fantastic. I think it works great for both men and women. But for people that have lost their hair, it's better to go to a hair transplant specialist. And I don't do hair transplant in my practice.
You are known as the face man. Why do you think that is?
I think your community and your patients usually direct where your career should go. So very early on in my career, I took an interest in the face, and I think I deliver very, very nice results for faces. And so we've made a reputation for ourselves for faces and for noses. I think I have a good sense of three-dimensionality and a good sense of beauty and a good sense of detail. And I guess people recognize it, and I've been labeled as such. I think usually your community and the world in general dictates what your reputation will be. And I think that's what happened with me.
What's your favorite thing to do? If when you're, I've clearly you perform many surgeries, but what do you get really excited about? What is the most challenging that you get the most reward from performing in your practice?
Plastic surgery is amazing because every surgery is different. It's not an appendix or gallbladder where there is variation in anatomy, but more or less it's really usually the same except for the pathophysiology that can be different. For plastic surgery, every surgery is very specific. Every surgery is a study. Every surgery, you can strive toward a perfection. So I enjoy every procedure that I do, and I do it for a lot of detail and a lot of love. I think as a plastic surgeon, if you were to lose this one day, I think you would lose your edge. So that's how I see it. I think the more challenging the procedure and the more I can help somebody with a very difficult issue, obviously the better it is. But I really enjoy everything that I do to a great degree.
I know a lot of plastic surgeons that perform that have artistic pursuits, and you're an artist as well outside of your office, right?
I enjoy art. I enjoy photography. I studied photography a long time ago, and I enjoy photography immensely. And then I dabbled into painting, and I enjoy that as well. And then more recently, sculptures, because with the kids at home, it's very hard for me to find all the time to do the photography that I enjoy to do. So when they go to sleep, I still have time at home at night, and I use my creative side more and more to do sculptures. I think every very good plastic surgeon is a frustrated artist because it's the search for beauty, is the search for perfection, and that's the basic of art. So I think every great plastic surgeon or good plastic surgeon is inside an artist.
Thank you, Dr. Jhonny. I'm sorry, I keep calling you Dr. Jhonny, Dr. Salomon, but we're friends, so it's how I've always called you.
Dr. Jhonny is just perfect.
I want to know more about other parts of the body that you perform plastic surgery, because I know you perform other procedures outside of the face. So if someone is coming in for a consult for a breast augmentation, how do you go about it? Someone that's coming in for the first time wanting to get breast augmentation, what does that look like?
Plastic surgery in an art is an art that is owned by the patient. It's not a canvas where you can appreciate it or not appreciate it or connect with it or not connect with it. The patient lives with your art. So the art has to be tailored for that particular patient. So what I try to do when somebody comes for anything, but breast is in and taste, I really try to get into their mind and see what they're looking for. And I do this with pictures that they could bring or my own before and after photos. I really try to get a sense of what they feel that they're attracted to, what their body would connect to, what their family would connect to. So sometimes I have patients from other parts of the country that come and want a very natural result. Maybe just a little bit of lift with no implants. Maybe with a lift and putting a little bit of fat in the breast, but no implant. And then you have the other extreme of people that are wanting what I think is above the normal sizes, almost superhuman sizes. So it's a very wide audience, the audience for breast augmentation. And I try to understand exactly where they are and what they're looking for. If someone, for example, is referred by a patient that I've done 6 months ago who wanted a natural result, who's a mom with 3 children, I kind of know what they're looking for. And if they're referred by somebody that has a larger result and that they feel that they're attracted to that look, then I know what they're looking for. So I really try to get in a patient's mind to see really what they're attracted to. And that's a big part of plastic surgery. The art is one, the other part is the psychology.
Right, getting to know your patient. I have a question in regards to facelift again. Are there threads, are the threads a temporary alternative for a facelift, or is there a version of a facelift for a younger candidate?
I think the threads are for younger patient with minimal aging of the mid-face. And I think they work between 6 months to a year. And it's a good result for somebody that does not have a lot of late aging and that's looking for a short-term improvement.
What are the best options to deal with wrinkles under 30 years old besides Botox?
Botox works mainly for the forehead and for the crow's feet around the eyes, and also for the neck. The lines in here, the nasolabial fold, in here, the marionette lines, these lines in here, they respond more to fillers. So if somebody comes with very deep lines in here, I'll do a combination of Botox and fillers. And as well, for the crow's feet, sometimes I do a combination for Botox and fillers. So for someone under 30, it depends which line they come, which line bothers them, but it could be a combination of Botox and fillers for them.
But is there any other treatment someone under 30 can do besides Botox? That's the question.
Oh, besides Botox, I think a good skin regimen is always important, with retin-A and a moisturizer, good sunblock, hydrofacial or another type of facial every month or so, a great diet, avoiding the sun. I think it's mainly preventative before 30. And then once the line starts becoming a little bit deeper, then the Botox and the fillers become the treatments of choice.
When someone comes to your practice and they ask you, they're there for a rhinoplasty consult, what typically are they asking for in terms of aesthetic result? Is there a through line in the request and what that looks like?
I think the majority of patients seeking rhinoplasty have either excesses of the dorsum, we call it the dorsal hump, or malposition of the tip, or the tip being too wide. I think those are the most common problems that people present with. But the gamut of issues of the nose is immense. Sometimes I do an ethnic rhinoplasty where rather than removing from the dorsum, I'm adding cartilage to the dorsum because it's too low. Sometimes it's the width of the ala, which is this part in here, that is the issue, and that's more complicated to correct. So the gamut of presentation for the nose is immense. In addition to this, some patients will have breathing issues in addition to the aesthetic issues that would need to be addressed at the same time as the rhinoplasty. So there are all types of presentation for a rhinoplasty. But the most common one is someone in their 17, 18 years old, where the dorsal hump is too high, the malposition of the tip either too low or too high. That's the most common presentation.
What does this recovery from rhinoplasty look like? Stages, time frame, is what scarring can be expected?
The usual rhinoplasty, I use a splint for 4 days, and I do not use nasal packing. So I think my recoveries are a little bit easier than most because I don't use the packing. The packing, you can breathe with the packing, and that makes people feel very uncomfortable. So I had my nose done when I was very young, and I had the packing, and I decided never to use it in my practice, and I never did. I use other techniques to do what the packing would do. But someone could return to work about 5 days to a week after the procedure is done. I think the pain level is not a very, very high pain level threshold. I think most people may take a pain pill that first night and maybe not afterward. What I really recommend in the recovery of the rhinoplasty is to have these lymphatic drainage massages that we provide in our practice. I think the chance of revision of a rhinoplasty around the country is around 30%. I think in my practice it's about 1 to 2%. So part of it is the detail that we put into the procedure, but part of it is also these massages. If there's a little bit of blood, a little bit of fluid and underneath the skin in one part, with the massage you can remove it, and then it doesn't become a problem in the future. So that's more or less the recovery part. I think most people are back at work in a week after a rhinoplasty.
If someone wants to do multiple procedures like rhinoplasty, brow lift, Botox, do you recommend doing them all simultaneously or separately? What are the pros and cons?
It depends on the combination. I don't like to do Botox when a patient is asleep because they cannot move their forehead. I don't have as much of a gauge of their muscular function as I would if they were awake. So I don't like to do Botox. I don't like to do fillers while someone is asleep. But if someone comes and they're young and they're healthy and they want a combination of a nose with the lower lid, for example, which is a common one, or the nose and the forehead, I don't think that's a bad combination. And as I mentioned before, a facelift with a rhinoplasty sometimes can be a very good combination also for the right patient. So it really depends on the combination. It depends on the patient. It depends on how healthy they are and what kind of anesthesia and how long of an anesthesia they can tolerate.
What's a solution for the lines under the eyes, the tears, trows?
The tear trough, we call it the nasojugal fold. There are only two solutions. Either you inject them with a filler, and Restylane and Bolotero are the best two fillers under the lid. And that usually gives about 30%, 40% improvement for about a year. And then the lower lid blepharoplasty, which part of the technique sometimes involve repositioning of the fat of your eye. So rather than removing all of the fat that's in excess in the lower lid, you remove some, and part of it is repositioned right underneath that fold in order to remove that fold completely. And that usually gives at least 90% improvement to the nasojugal fold, even more sometimes.
Are there any procedures that you've done especially stand out in memory to you? Any procedure that was very challenging or that's really changed someone's life?
So many over the years that I can think of just right now. I took care of this young boy. It started 17 years ago as a reconstruction case through an operation called Day of Smile, which is a charity out of Baptist Hospital here in Miami. And I helped him through the years. He was born with a very complicated craniofacial deformity called Treacher Collins that involves the forehead and the chin and the eyes and the nose, almost every part of the face. And then you're born without any ears. And so he was an orphan from Poland. He came here with a family on a medical visa. And I started his ear reconstructions at first, and then I did his chin, and then I did his cheeks, and then I did his eyes. So over a period of 7 years, I reconstructed him. And then he ended up being adopted by this family in Palm Beach, being an orphan from Poland to an adoption. And incredible how life works. This kid ended up going to Juilliard and is a musical prodigy. He plays every instrument except from the flute. So he's one, and we had a show for Discovery Channel about him. So he's one that really enlisted friend through the years, and he's a very special person for me. But so many procedures, especially the reconstruction ones, they really stay with you. And obviously the cosmetic ones as well, because you really change your self-confidence, how they go through life, how they feel about things, how they feel about themselves. So you really can make big changes in people's lives. So almost every one of them. And you know me personally, so you know, I stay very engaged with my patient at an emotional level. So, you know, they stay in my life. So they're all meaningful to me.
Thank you, Dr. Jhonny. It's such a pleasure to sit with you today and see your face and hear your stories. When you just
Thank you.
listen, I was just listening to the story I've never heard of someone's ears being reconstructed. What does that mean?
Well, it's called microtia. So it's a genetic defect, and it can happen by itself or with other craniofacial syndromes. And it could be one ear, it could be both ears. So reconstruction procedures start around 6, 7 years old. And what you do is you take, the rib is still very soft at that age. You take 2 ribs and you literally carve an ear out of the ribs because it's very soft, it's the cartilage part, with very special tools and technique and wires and what have you. It's really a sculpture. And then you place that framework under the skin. That's the big first procedure. And then there are 3 or 4 small procedures after that to make it look great. But that's called a complete ear reconstruction. And as part of my craniofacial training, I did a number of these, and I do them now in practice, usually for charity.
When you do these type of surgeries, do you have to collaborate with another physician, someone else does ear, nose, and throat, or is there a...
Yes. If there are middle ear deformities, sometimes you have to collaborate, but not at the same time. But afterward, they see a special ear, nose, and throat doctor that deals with middle ears, recreating the canal and what have you. So usually you have to work with them, not at the same time, but over time to take care of these deformities.
Thank you. Well, I want to thank you for joining us today and for being a part of this webinar. It's a real pleasure to have you. I mean, we love you. And it's good to know that you're doing well with the babies at home here in Miami.
Thank you. So it really was an honor to be part of the team that you interview. It's you, everyone of the Hot Living family. They're very special to me. They're like my family. And it's really an honor to be part of this interview. And I'm happy that everyone on your side is doing well also.
Absolutely. We just got one more question in. Let me ask, what sort of procedures do you recommend for people who have small, stubborn, fat areas?
It depends where. What part of the body?
They didn't specify.
Anywhere?
Yeah. Arms.
You know, it's there are many tools, and it depends on the expectation. So if somebody comes to me with a little bit of skin excess in the abdomen, let's say, and it's a small amount, and they could work it out, but maybe it's a little bit too much to do with just exercise. Most of the time, I recommend cool sculpting, which would destroy part of the fat cell without surgery. And it's done very easily in a quick process. And then sometimes afterward, let's say the fat is disappeared and they say, I want to build muscle, but it's more than I want to do with exercise. We have technologies like EM Sculpt that will build muscle underneath your skin, which is amazing. And if obviously there is more fat and the expectation is for more of an improvement than liposuction, which is the gold standard for removing stubborn fat. But there is a whole gamut of different procedures that can be done for for fat removal.
I think that's all the questions we have today.
Thank you so much. Thank you. Really a pleasure talking to you. And I hope everything goes well through this. I'm sure we'll see each other on the other side. And I hope the other side is soon.
Us too. Looking forward to a new normal again.
A new normal. Yes. Thank you.
Talk to you soon.
Have a great day.
Thank you.